everyone. Today I will demonstrate the thyroid gland. The thyroid gland is one of the vital endocrine gland of our body. It is a highly vascular ductless gland. It is present in the lower anterior part of our neck. Against the trachea, it is present in front and on both sides, extending from C5 to first thoracic vertebral level. This butterfly-shaped gland consists of two lobes, right and left, with a median isthmus connecting the two lobes. Each lobe extends from middle of thyroid cartilage up to 5th or 6th tracheal ring. The isthmus extends from 2nd tracheal ring to 4th tracheal ring. The thyroid gland weighs about 25 grams, but in females it is slightly larger in size, but the size increases further during menstruation and in pregnancy. Each lobe of thyroid gland measures about 5 cm in length, 3 cm in breadth and 2 cm in thickness. The isthmus part measures about 1.25 cm both in length and breadth. Each lobe of thyroid gland is roughly pyramidal in shape. The anterior portion of thyroid gland is slightly convex. The posterior portion of the thyroid gland is comparatively flattened out. The thyroid gland is enclosed by true capsule and false capsule. The true capsule is formed by the condensation of the fibrostroma. The false capsule is derived from the pretracheal layer of deep cervical fascia. The false capsule is thickened on the medial portion and it leads to the formation of ligament of Berry, which connects the lobe to the cricoid cartilage. Each lobe consists of two borders. This is the anterior border and this is the posterior border. There are three surfaces. This is the superficial or anterolateral surface. This is the posterolateral surface and this one is the medial or deep surface. This pyramidal lobe consists of apex as well as base. So if I grossly see the structure, there is the apex, base. This is the superficial surface or anterolateral surface. This is the anterior margin. This is the posterior margin, posterolateral surface, and this one is the deep surface. Coming to the isthmus part, it consists of two borders, the upper or superior border, lower or inferior border, anterior surface and posterior surface. Each lobe of thyroid gland is related to the surrounding structure. First, coming to the anterolateral surface, the anterolateral surface of the thyroid gland is covered by anterior border of sternocleidomastoid, the sternohyoid muscle, superior belly of omohyoid muscle as well as sternothyroid muscle. The sternothyroid and superior belly of omohyoid muscle are also known as strap muscles of the neck. The posterolateral surface, it is related to the carotid sheath with its contents. The contents of carotid sheath include the internal jugular vein, the carotid artery and the vagus nerve. Coming to the medial surface, the medial surface is related to two tubes of the respiratory system, trachea and larynx, of the digestive system, esophagus and pharynx. It is related to two nerves, recurrent laryngeal nerve and external laryngeal nerve, as well as it is related to two muscles, inferior constrictor muscle and cricothyroid muscle. Coming to the anterior border, the anterior border is related to the anterior descending branch of superior thyroid artery. The posterior border, it is related to inferior thyroid artery. Anastomosis between the superior and inferior thyroid artery, as well as the posterior border is related to the parathyroid gland, and on the left side it is also related to the thoracic duct. These are the relations of the two lobes. Coming to the isthmus part, the upper border of isthmus is related to the anastomosis between right and left superior thyroid artery. The lower border of isthmus, it is related to inferior thyroid vein as well as thyroidea ema artery. The anterior surface of isthmus is covered by sternothyroid muscle of both sides, investing layer of deep cervical fascia, anterior jugular vein, superficial fascia and the skin. The posterior surface of the isthmus is lying against the second, third and fourth tracheal ring. Now in some thyroid, the upper border of the isthmus is related to the presence of an accessory lobe known as pyramidal lobe. Sometimes a fibromuscular band extends from hyoid bone to the upper border of isthmus or pyramidal lobe, known as the levator glandulae thyroideae. So these are the general relations of this thyroid gland. Now coming to the most important relation of the thyroid gland, that is near the apex, there is divergence of the superior thyroid artery and external laryngeal nerve. Whereas near the base, the inferior thyroid artery and recurrent laryngeal nerve comes closer. The nerve presents variable relation with inferior thyroid artery. It may be present anterior to it or posterior to it, or may be present in between the branches of inferior thyroid artery. Coming to arterial supply of this thyroid gland, this highly vascular gland, the vascularity is comparable to the adrenal as well as kidney. It is supplied by superior thyroid artery, which is a branch of external carotid artery derived from common carotid artery. This superior thyroid artery, as it reaches the upper pole, give rise to anterior glandular branch and posterior glandular branch. The anterior glandular branch runs along the upper anterior margin, then the upper border of the isthmus, and anastomos with this fellow of opposite side. The posterior glandular branch runs along the posterior border and anastomos with the ascending glandular branch of inferior thyroid artery. The inferior thyroid artery is derived from the thyrocervical trunk, which is coming from the subclavian artery. In 10% of population, there is presence of thyroidea ema artery. This is an unpaired vessel which may arise from brachiocephalic trunk or arch of aorta, and in some from right common carotid artery and also from the subclavian artery. Other than this, accessory thyroid vessels supply the deep surface of the gland derived from esophageal and tracheal arteries. Ligation of arteries is very much important during thyroid surgery. The superior thyroid artery is ligated close to the gland to preserve this external laryngeal branch. Inferior thyroid artery is ligated away from the gland to preserve this recurrent laryngeal nerve. Now coming to the venous supply, this thyroid gland will include the superior, middle and inferior thyroid vein. The veins are derived from the venous plexus lying beneath the true capsule. Superior and middle thyroid vein, they drain into the internal jugular vein. Inferior thyroid vein emerge from the lower border of isthmus and they finally drain into the brachiocephalic vein, more commonly on the left side. The veins do not accompany the artery. In some cases, there is presence of one extra vein known as the Kocher's vein, which arises from the lower pole and drains directly into the internal jugular vein. Talking about the lymphatic drainage, the lymphatics form a plexus around the thyroid follicles. They are arranged into upper group, which drains into the prelaryngeal group of lymph nodes and jugulo-digastric group of lymph nodes. As well as it is arranged into lower group, which drains into pretracheal group of lymph nodes and a group of lymph nodes present along the recurrent laryngeal nerve. The thyroid gland has both parasympathetic and sympathetic nerve supply. Parasympathetic nerve supply is derived from the vagus nerve as well as from the recurrent laryngeal nerve. Sympathetic nerve supply is derived from the superior, middle and inferior cervical ganglia. But the sympathetic is mainly vasomotor supply. The endocrine function of the gland is controlled by the thyroid stimulating hormone secreted by the pituitary. Talking about the endocrine function, the thyroid gland is unique among all endocrine glands in that it manufactures, stores and releases thyroid hormones, which includes the thyroxine, thyroiodothyronine, triiodothyronine and calcitonin as and when required. It is the only endocrine gland that depends on external environment for its raw material. This thyroid gland is essential in our body and its gross anatomy is required both in our day-to-day clinical practice as well as surgical practice. The thyroid gland maintains the basal metabolic rate of our body, regulates the somatic, psychic growth, as well as regulates the calcium metabolism. Decreased production of thyroid hormones leads to hypothyroidism, which is resulting in myxedema in adults, cretinism in children. Hypersecretion of thyroid hormone leads to hyperthyroidism. Any dysfunction of the thyroid gland hormone production leads to enlargement of thyroid known as goiter. During surgery, the thyroid gland is removed along with its true capsule. And during ligation of arteries, care is taken not to injure the laryngeal divisions of the vagus nerve. That's all for today. Thank you.